to present a very sad story from Greece. Just for the beginning, I just want to set the record straight with regard to the slide by the Foudouliakis work. There is now a recent publication in BMJ Open which actually has corroborated that we have a substantial increase in suicide rates from summer 2011, when the austerity measures started being implemented. Then we have an abrupt and substantial rise in suicide rates, just to set the record straight, because there's a huge debate in Greece with regard to suicides. I will not concentrate on suicides. I will concentrate on other manifestations of psychiatric morbidity and try to give you the picture of what's going on in Greece. It is already known that the global financial crisis has been the most severe economic contraction since the Great Depression, with roughly all developed countries experiencing deep recessions since its outset in 2008. Well, it started off in the American continent, but its tremors were more strongly felt in Europe, and more specifically in the Mediterranean countries. This international recession, along with a local unrelenting spending on the part of the Greek government, led the Greek economy, after many consecutive years of growth, to go into reverse, and it gave rise to what we know today as the Greek economic crisis. During the 5-year period of the recession, the gross domestic product in the country fell by 20.8%, only to return to its 2002 level. At the same time, national debt keeps rising. So it was 105.4% of GDP in 2007. It was transformed into 152.6% in 2011, and now it's 174.1%. To cope with a grim financial situation, and in order to avoid a potential default that would further endanger the stability of the global economy, the international community and the Greek government agreed on 2 bailouts, one amounting to 110 billion euros in 2010. Money was not enough, so we signed another one amounting 130 billion euros in 2011. In return, the Greek government was expected to implement a series of structural reforms and austerity measures. This has been the humorous side of the story. But this is its harsh reality. People do not have food to eat. 2.5 million, and I always mention not the rates, the number, the absolute number, are living below the poverty line. Additional 3.8 million people are at great risk of crossing it shortly. A survey by the Hellenic Confederation of Professional Craftsmen and Merchants highlighted substantial income loss for 93.1% of households during the last 3 years, with subsequent reductions in expenses for basic goods and food. 2 out of 5 people consume low-quality food on a daily basis. Of course, as a corollary of this, evidence shows that 30.4% of children is at risk of poverty. We have many children fainting in school backyards because they don't have enough food. And a growing number of them receives inadequate nutrition. Unemployment. I've heard so much about unemployment, but in Greece, it's a Greek conundrum. As a corollary of the implemented measures that have actually disrupted and dismantled the labor market in Greece, and in combination to the contraction regarding the domestic demand and the purchasing power, the number of employed individuals was reduced by 20%, the time period 2010 to 2013. Unemployment rates reached as high as 27.8% in 2014, and this is 1,342,299 people, and I guess we are the highest rate in European Union, unfortunately, nowadays. According to the Institute of Labor, which belongs to the Confederation, the General Confederation of Greek Workers, it is anticipated that by 2020, the rate of unemployment will not drop below 22 to 23%. That is 1,150,000 individuals. And this will have, of course, very negative implications for a country like Greece, where the number of unemployed individuals will be above 1 million for more than a decade. This is just a graph showing that in 2014, only 8.3% of the unemployed receive benefits for their unemployment. I don't know how these people manage to live every day. Of course, the pervasiveness of the global financial crisis has had health implications. Recent reviews on the health effects of the crisis in Greece have suggested an increasing incidence of HIV infections and tuberculosis among injected drug users, the re-emergence of malaria, we're back to medieval years in Greece, high mortality burden of pandemic influenza, and a major outbreak of the West Nile virus, among others. Of course, most of these outbreaks have been ascribed to environmental triggers, but the preventive public health measures that would have contained the spreading of these aforementioned epidemics were not properly implemented, most likely due to the dismantling of the pertinent services. What about the mental health effects? In this context, the University Mental Health Research Institute has tried to monitor the mental health effects of the financial crisis. So we have conducted a series of cross-sectional surveys in 2008, before the crisis, 2009, just at the beginning of the crisis, 2011, after the introduction of the memorandum in the country, and in 2013. There's a number of publications that have accompanied this research effort. In terms of its research methods, the samples were always random and representative of the adult population in all 4 surveys. They were different samples. This is not a prospective, longitudinal, or cohort study. The sampling frame was the National Landline Telephone Data Bank, providing coverage for the vast majority of households in the country. Within each household, the adult who had their birthday last was selected for the interview. Sample size was roughly 2,100 people. They were interviewed over the phone, and the response rates were relatively high for Greek research. Major depression and generalized anxiety disorder were ascertained by the pertinent module of the structured clinical interview. So what we have found is that you can see that in 2008, 1 month prevalence of major depression was 3.3%. And since then, we have a gradual but steady increase in 1 month prevalence of major depression, reaching roughly 12% in 2013. And this is 1 month prevalence, not 1 year prevalence. Risk factors for major depression in 2013 is female gender, of course. This is explained by the classical epidemiology of the disorder. Residents in rural areas, I think this is possibly because when the crisis started in Greece, it started in the urban centers and in Athens. But now, because of its enduring nature, it has actually spread and expanded from the urban centers to the rural areas as well. It's, of course, unemployment status, because the rates are very high. And, of course, we're not positive that they will drop as well. So the duration of unemployment is always long-term. And the high economic distress, which is explained by the well-established association of depression with financial hardship. We had 2 protective factors. One is undergraduate studies, and the other one is the family income between 1,500 euros to 3,100 euros. And they are the ones that they are in between, so they don't feel undervalued, for example, because they have spent a lot of money on their education. And at the same time, they are more likely than people with low financial income and with, let's say, high school graduates. They're more likely to find a job. So they're in the middle. What is very interesting is that if we see a prevalence of major depression as a function of gender and age, what we can see is that for the age band 35 to 44-year-olds, so young people at the productive age, men actually outnumber women. And this is in sharp contrast to the epidemiology of the disorder, and it's possibly explained by the work conditions. And Greece, it's still a very conservative society, so men are still the breadwinners in Greece. A very interesting finding that we found in 2013 survey is that 2% of the population reported that they resort to gambling in order to deal with financial hardship. And in a multivariate analysis, what we found is that we found financial distress and working hours to bear an independent effect on gambling. So for every unit increase in the index of personal economic distress, the odds of gambling increased by 12%. This is gambling involvement, not necessarily pathological gambling involvement. And participants who reported working for more than 40 hours per week were roughly 4 times more likely to gamble than those who reported working less. When we investigated a cross-tab with criteria for major depression and suicidality, we actually found more or less a protective influence. So only 1% of people who reported that they gamble meet criteria for MDE and 0 for suicidality, while 16 of those who reported that they do not gamble have MDE and 2.6% of suicidality. These differences did not reach statistical significance, I presume because of the low statistical power of the analysis, but they do suggest that gambling offers an alternative to the dead end created by the dire financial hardship in Greece, buffering to some extent against the hopelessness, which is a very strong risk factor for both major depression, suicidality, and suicide. However, the international literature, of course, indicates that when gambling turns into its pathological form, then it progresses through 4 stages, leading thus to the same death it wished to avoid. But what is important is we haven't found increase in the prevalence of alcohol abuse and dependence in Greece, but we do anticipate an increase in the prevalence of pathological gambling the following years. In terms of generalized anxiety disorder, we have found the exact opposite results from our colleague in France. What we have found is for the population as a whole, 1 year prevalence of generalized anxiety disorder does not change. What we've seen is substantial changes in the prevalence of generalized anxiety disorder for specific population subgroups: men, people of working age, married individuals, respondents who had completed undergraduate studies, employed participants, and citizens of Athens. You can see there are complementary risk factors to the ones we observed almost for major depression. So changes in generalized anxiety disorder are probably explained by the work condition and perhaps by job insecurity. Let's not underestimate that as well. It's not only unemployment, it's flexible employment, part-time employment, and job insecurity, which are significant problems coming with the financial crisis. Complementary data from the Depression Telephone Helpline. This is a nationwide telephone helpline providing information on mental health issues and brief counseling services from 2008 to 2014. This helpline is no longer in operation due to lack of funding from the Ministry of Health. The callers who referred to the economic crisis manifested depressive symptoms of clinical significance to a greater extent than callers who made no such reference. Depressive symptoms were assessed by the Goldberg Depression and Anxiety Screening Scales. In addition, we had a higher frequency of depressive symptoms among unemployed individuals, whereas employed people were found to experience anxiety symptoms to a higher degree. It seems more or less in Greece that depression constitutes a response to loss, like job loss, while anxiety constitutes a response to the idea of threat, the fear of losing one's job. Sad story, I've told you that in advance. But what lies ahead in Greece? What has been done already so far to mitigate the mental health effects of the financial crisis? Nothing, zero, niente. I know this Italian word. So it was about time to start exerting some pressures to policymakers to start implementing interventions or changing policies in order to mitigate the mental health effects of the financial crisis. First of all, we should start by ending the denial. We have a problem in Greece and it's substantial, so we have to do something to cope with it. A good way to start is by restructuring the services for timely and effective treatment of people who display psychiatric morbidity. You might have heard that we don't have a very well-established primary healthcare system in Greece, of course. And we have somehow to identify and treat people who are at high risk for manifesting major depression. At the same time, we need multifaceted interventions covering simultaneously. The emphasis, please, is on simultaneously, on unemployment, financial difficulties, social capital deficiencies, and mental health problems. You need to target all 4 of them at the same time. We had, in one of our research, in one of our publications, in Social Science and Medicine, what we found is that social capital, for indices, indicators like social trust and social support, protects you against major depression and generalized anxiety disorder, provided that you don't have high economic distress. If you have high financial hardship, they no longer exert a protective influence. So you can't just say, we need to enhance social capital. You need to give money to the people. And of course, we keep reminding to ourselves that life begins on the other side of despair, of course, and that we need to be proactive. Thank you very much.